So we talked about ways to relieve symptoms. Now we're going to focus on specific nutrients to support the immune system. And many of these are nutrients that we've already covered in lots of other conversations. And this gives you an idea of how important they are for many functions in the body. So we'll talk mostly about food sources, and then I'll mention some common dosages for supplements, but of course it's always important to assess and get advice about whether you need a different amount or what's appropriate for a specific condition. So the first supplement, and one of my favorite supplements for supporting the immune system, is zinc. I think zinc has so many amazing properties as an anti-inflammatory support, immune support, and antioxidant. So in terms of zinc in the body, one of the interesting things is that people on a plant-based diet tend to have lower amounts of zinc, partly because zinc binds to phytic acid in our foods. In other words, it's just a little bit less bioavailable. So the suggestion is that someone on a plant-based diet needs to increase their zinc by about 50% compared to people who consume animal products. So just a little idea of how much more you might need to think about zinc if you happen to be plant-based. So how much zinc do we need every day to just support our body's natural processes? The recommendation is between 8 milligrams to 11 milligrams a day. And so this would be just as a daily need for most people. In terms of food sources, we want to look at pumpkin seeds, squash seeds, and hemp seeds. They have approximately 4 milligrams for 4 tablespoons. So if you want to get about 8 milligrams a day, then you could have 4 tablespoons just from your pumpkin seeds, and then hopefully get the rest from other sources. Another source would be oysters. Oysters are really high in zinc, and actually about 3 oysters can give you close to 150 milligrams. So you really don't need many oysters to get your needs met. And then we also see zinc is higher in animal products, so red meat will have slightly higher amounts of zinc. And we also know that there is zinc in legumes, so lentils and beans. The issue with the legumes has to do with the phytates and the potential for that zinc to be maybe slightly less bioavailable. But you still will absorb some, and so it's considered a great source for vegetarians or people on a plant-based diet. In terms of taking a zinc supplement, when people are using it to support an immune condition, so specifically they have an upper respiratory tract infection and they want to take something a little bit at a higher dose, then in that case we would give zinc somewhere between 30 to 50 milligrams. And you only want to do that for a shorter amount of time, so maybe 5 to 10 days, and then take a break or cut back significantly. And the reason is that zinc can accumulate over time and cause a copper deficiency. In shorter amounts though, it's totally safe for most people to take 30 to 50 milligrams. But the other really important detail is that zinc will make most people very nauseous on an empty stomach. And it's fast and it's a pretty overwhelming experience if you're not expecting it. So you always take zinc with food. And that's really, really important to remember. It's an amazing supplement. It works very well, but you should always take it with food. The second nutrient is vitamin A. Again, something we've talked about several times already throughout the course. Vitamin A is the name of a group of fat-soluble vitamins. There's actually a few different forms of vitamin A. And in general, vitamin A is helpful for a range of things, including immune function, vision, reproduction, cell communication, cell differentiation. So it has a powerful effect on the cells of the body. The 2 forms of vitamin A that are available for humans are a preformed vitamin A. This is also referred to as retinol, and this comes from animal sources. And this is considered to be an active form of vitamin A. And we also have carotenoids like beta carotene, which are a provitamin A. And that means they'll be converted into the more active form. In other words, you can get vitamin A from animal sources, and you can also get it from plant sources, but it's in slightly different forms, which will then be converted in the body and used for various functions. When we think about food sources, the animal sources that are rich in vitamin A would be egg yolks, liver, organ meat, things that are naturally rich in vitamin A from the animal. And this is because we store vitamin A in the liver. So when we consume the liver of animals or we consume the oil from liver of animals, that's where we're getting the vitamin A from. In terms of beta carotene, again, we're looking at those pigmented vegetables. So ones that we've mentioned in the past, carrots, sweet potatoes, red peppers, etc., all going to be rich sources of beta carotene, which will then be converted into vitamin A. In terms of taking a supplement, vitamin A is another example of a vitamin that can have toxicity at high doses. And we should also not take a vitamin A supplement in the first trimester of pregnancy. Having said that, many people, when they feel sick, will try taking a vitamin A supplement to help support their mucous membranes. We're supporting the lining of the lungs, and we're supporting immune response. In that case, we take somewhere between 5,000 to 10,000 international units. The upper tolerable limit is 10,000 for most people. And then from there, we would take that for, again, maybe 10 days, maximum up to a month, and then you can back off. But you can actually get a considerable amount of vitamin A from food sources, and you may not need to look at supplements if you're consuming a range of foods, including animal and plant-based foods. The third nutrient to support the immune system is vitamin C. And many people have heard of or use vitamin C during cold and flu season. Now, in terms of how effective vitamin C is, the research is still unclear about that, but it's a very safe supplement, and we know that it supports antioxidants and also may support neutrophils, those immune cells that are patrolling the body. So to take vitamin C, you can easily get it from a rich source of foods: papaya, strawberries, broccoli, beet greens, citrus, and rosehip tea. Just including a range of different fruits and vegetables in the diet will ensure that you have more than enough vitamin C. It's really easy to get from whole foods. In terms of supplements, most people take 1,000 milligrams a day, and you can take more than that, but as you go up, there's an increased risk for a looser bowel movement. The other thing with vitamin C is that it's ascorbic acid, so it actually can be a little bit irritating to the teeth and the throat and the stomach if you take a lot of it. So you might just want to be mindful for how you're taking it. If it's chewable, it could actually be dangerous for the teeth over time if you're having a lot of it. If you're drinking it as a powder, again, you just want to be mindful of how that might be affecting the esophagus. In smaller amounts, it's probably not an issue, but when we're increasing those amounts and we're having them often, that's when we may want to focus more on a food-based source of vitamin C and then just supplement that a little bit on the side if needed. So far, we've talked about zinc, vitamin A, and vitamin C as our core nutrients for immune support. And the last one I want to mention is vitamin D. We mentioned this in the autoimmune unit, and that's because vitamin D is so important for overall immune modulation. In this case, we're using vitamin D as prevention and also just long-term support. So it wouldn't be something that we take short-term for just a few weeks. In vitamin D, we're looking to have long-term support over many, many months and just make sure that our baseline levels are supported. When it comes to food sources, vitamin D is not very high in many foods. Some sources would be our cod liver oil, again, because it comes from the liver and vitamin D is stored in the liver. Some dairy products are fortified with vitamin D. And we also know that some mushrooms, when they've been exposed to UVB light, will have small amounts of vitamin D. But generally, vitamin D is not really considered a food-based vitamin. So we need to think about getting some UV light exposure or taking a supplement to help support those levels. We know that vitamin D is also stored in the body. So some people will maximize their vitamin D in the summer whenever they can, and then that ideally would get them through the winter months. But in places where people are having long stretches of time without sunlight, or maybe they're working in an office environment, or they have that darker skin pigmentation and they can't synthesize vitamin D as well, in those situations, a supplement can be really important for long-term immune support. And so if you remember, we're giving dosages that are a maximum of 20,000 IU a week, and you can space that out throughout the week, so a couple thousand IU a day is pretty common to see.